What if the Black Plague started today? A businessman boards a flight from Mumbai to London. He feels fine. 12 hours later, he's in the ER with a fever, swollen lymph nodes the size of eggs, and black tissue spreading across his skin. He's got bubonic plague, the same disease that killed half of Europe in the 1300s. And he's been breathing recirculated air with 300 other passengers who are now scattered across 6 countries. The medieval plague killed 1 in 3 people on Earth. 75 to 200 million dead in 7 years. Entire cities abandoned. Civilization nearly collapsed. But we have antibiotics now. Modern medicine. Quarantine protocols. Surely we could contain it. Or could we? This is a fictional scenario exploring what happens if Yersinia pestis, the bacteria that causes plague, emerges today with the same virulence it had in 1347. If you want to see whether modern civilization could actually stop history's deadliest pandemic, or whether we're more vulnerable than we think, subscribe now. Because what you're about to discover might terrify you more than the medieval version ever could. Let's find out. Our patient zero is a dock worker in Mumbai. He contracts plague from infected rat fleas in a warehouse district with poor sanitation. This is plausible. India still reports dozens of plague cases annually, though they're usually contained. But this strain is different. It's as virulent as the medieval variant, with 60 to 90% mortality if untreated, and a 3 to 7 day incubation period. Crucially, people are contagious before showing symptoms. Patient zero feels slightly unwell, but not sick enough to miss work. He handles cargo, interacts with dozens of co-workers, takes crowded trains home. His wife is a nurse. His daughter attends a school with 800 students. His son works at a call center with 200 employees. By day 3, when patient zero develops obvious symptoms, fever, swollen lymph nodes, chills, he's already infected 23 people. They've infected hundreds more. The exponential curve has begun. He goes to a hospital. The doctors are confused. Plague? In 2025? It takes 2 days to properly diagnose because it's so unexpected. During those 2 days, he's exposed everyone in the ER waiting room. Meanwhile, 3 of the people he infected have traveled. 1 flew to Dubai. Another took a train to Delhi. The 3rd went to a wedding with 500 guests. By day 7, there are approximately 2,000 infections across 6 cities in 3 countries. Only 50 cases have been identified. The rest are still in incubation or misdiagnosed as flu. The silent spread is already beyond containment. Week 2 is when authorities realize something is catastrophically wrong. Hospitals in Mumbai, Delhi, and Dubai are seeing unusual cases. High fevers, swollen lymph nodes, rapid deterioration, and a disturbing mortality rate. The World Health Organization issues an alert. Genetic sequencing confirms it's Yersinia pestis with unusual virulence. Epidemiologists trace the spread and realize it's already in 12 countries. This is where modern surveillance both helps and hurts. We identify the outbreak faster than medieval society could, but we also panic faster. Social media explodes with images of plague victims, medieval plague doctor masks, and apocalyptic predictions. Misinformation spreads faster than the disease, claims that it's a bioweapon, that antibiotics don't work, that governments are hiding the true death toll. None are true, but millions believe them. Governments implement travel restrictions. Too late. The plague is already on 6 continents. Australia and New Zealand close borders entirely. This actually works for them, creating island sanctuaries. The antibiotic supply crisis begins. Streptomycin, gentamicin, and doxycycline are the primary treatments. Global stockpiles are designed for normal plague incidents, maybe a few thousand cases per year, not hundreds of thousands. Pharmaceutical companies ramp up production, but it takes weeks. Meanwhile, people are dying because there aren't enough antibiotics to treat them. By week 3, confirmed cases exceed 100,000. Actual infections are probably 5 times higher. Death toll, 12,000 and rising exponentially. This is where everything breaks. Not because we lack medical knowledge, we know exactly how to treat plague, but because healthcare systems can't handle the volume. ICU beds are overwhelmed. In Mumbai, patients lie on hallway floors. In London, field hospitals are erected in parks. In New York, the Javits Center becomes a treatment facility. Healthcare workers are dying. Even with protective equipment, exposure is constant. Plague can spread through respiratory droplets if it develops into pneumonic plague, which happens in 15% of cases. Healthcare workers are exposed to the sickest, most contagious patients. Infection rates among medical staff reach 30% in the hardest-hit cities. As doctors and nurses die or refuse to work, healthcare capacity plummets. People with heart attacks, strokes, and injuries can't get treatment. The death toll from non-plague causes surges. The economic impact is catastrophic. Global supply chains collapse as workers stay home. Food distribution breaks down in major cities. Panic buying creates artificial shortages. Riots occur in several cities as people fight for resources. Governments implement medieval solutions: quarantine zones, movement restrictions, prohibition of public gatherings. Enforcement requires military deployment. Civil liberties are suspended. By month 2, confirmed cases reach 2 million. Estimated actual infections, 8 to 10 million. Death toll, 600,000. Mortality is lower than medieval rates. Modern antibiotics save many. But the absolute numbers are staggering because of global population density. Month 3 is when the war turns. Not through miracle cure, but through grinding logistics and brutal triage. Antibiotic production has scaled massively. Every pharmaceutical company globally is producing plague treatments. Supply begins meeting demand. More patients receive treatment within the critical first 48 hours, when antibiotics are most effective. Quarantine measures, though imperfect, slow transmission. The reproduction rate drops below 2.0, meaning each infected person spreads it to fewer than 2 others on average. The exponential growth stops. Vaccine development begins showing promise. Multiple research teams are working on plague vaccines. By month 6, early versions enter emergency use trials. They're not perfect, but they reduce transmission and severity. The death toll continues rising. Plague doesn't stop instantly, but the rate of increase slows. By month 6, the pandemic has infected approximately 40 million people worldwide. Death toll, 4 million. This is nowhere near medieval plague's mortality rate. We're losing 1 in 10 infected, not 2 in 3. Modern medicine works. But 4 million dead is still civilization shaking. Even after the outbreak is controlled, the consequences reshape society permanently. The global economy enters severe recession. Supply chain disruptions, workforce losses, and consumer panic create economic contraction worse than 2008. Unemployment exceeds 15% in developed nations, higher in developing ones. Healthcare systems are rebuilt with pandemic capacity in mind. Countries maintain permanent surge capacity, stockpiles of antibiotics, ventilators, and protective equipment. Permanent pandemic response teams are established globally. The cost is enormous, but deemed necessary. International travel never fully recovers to pre-plague levels. Biometric health screening becomes standard at all borders. Digital health passports tracking vaccination and infection history become mandatory for international movement. The psychological impact is profound. A generation grows up having experienced a pandemic that killed millions. Trust in institutions, government, healthcare, media, is severely damaged by the initial response failures and misinformation. Politically, countries split into two camps. Some become more authoritarian, using pandemic powers as precedent for expanded state control. Others experience populist backlash against the restrictions, leading to libertarian movements. Here's the uncomfortable truth. The medieval Black Plague killed a higher percentage because they had no treatment. But a modern plague outbreak could kill more people in absolute numbers because there are more people to kill. Medieval Europe had 80 million people. 30 million died. Today, we have 8 billion people. Even with antibiotics, even with modern medicine, if 10% of infected people die and we can't contain it early, the death toll reaches tens of millions. We're more vulnerable than we think because modern civilization depends on systems that are fragile. Just-in-time supply chains. Healthcare systems running near capacity even without pandemics. Global travel creating transmission networks medieval people couldn't imagine. We're also more resilient because we have antibiotics, vaccines, communication systems, and scientific knowledge. We can develop responses in months that would have taken decades historically. The question is, which factor dominates? Our increased vulnerability or our increased capability? COVID-19 gave us a preview. A virus with 2% mortality stressed healthcare systems to breaking point in wealthy countries. Plague has 60% mortality without treatment. Could we actually stop it? Or would we just slow it down while millions died anyway? This scenario is fictional, but based on real capabilities of Yersinia pestis. The bacteria exists. It still infects people. Most cases are treatable, but if a highly virulent strain emerged and spread globally before recognition, the results would be catastrophic. We learned from COVID-19 that pandemic response depends on more than medical science. It depends on political will, public cooperation, economic resilience, and international coordination. All of these failed partially during COVID, and that was a relatively mild pandemic compared to plague. The medieval Black Plague didn't just kill people. It ended the feudal system, sparked religious upheaval, caused labor shortages that empowered peasants, and fundamentally restructured European society. A modern plague would similarly reshape our world, probably toward more authoritarian pandemic preparedness states, with permanent restrictions on movement and association, and deep economic restructuring. The terrifying part? We can't prevent it entirely. Plague exists in nature. Rodent populations carry it. A highly virulent strain could emerge through natural mutation. No amount of preparation eliminates the risk completely. We can only prepare to respond. And whether that response would be adequate is an open question. Now I want to hear from you. After experiencing this fictional plague outbreak, do you think modern medicine and technology make us safer than medieval Europe? Or does our interconnected world make us more vulnerable? Would you accept permanent restrictions on travel and privacy if it meant better pandemic response? And do you think we actually learned the right lessons from COVID-19? Or are we still unprepared for something truly deadly? Drop your thoughts in the comments. And if this scenario made you reconsider how fragile our modern systems actually are, Share it with someone who thinks pandemics are a medieval problem we've solved. Because we haven't. We've just changed the variables